This concept of nature therapy is something that I try to utilize because the side effects are low and the positive gains are great. Whenever I try to make healthy lifestyle changes or design them for people, it always involves a form of mindfulness. I think we're lacking that in the typical American lifestyle. And if you are a martial artist or yoga practitioner or a meditator, you'll know about mindfulness. But the majority of patients that suffer from high blood pressure, insomnia, irritable bowel syndrome, problems with mood disorder, usually don't have a great grasp on that, and they are lacking the help to get and design programs to facilitate their own development of mindfulness. If you watch my videos on breath, that's a way in. That's no frills, doesn't cost anything. You can do it on your own in your house and not have to go anywhere. But if you want to really be empowered and overwhelm the senses, I think getting out to a trail is the best option. Again, there's no side effects to it. You just have, and you don't have to buy fancy equipment, you just have to find a safe and green pasture to get out and enjoy. Francis Kuo of University of Illinois studied people or kids in the inner city and found that there was less prescriptions for ADHD medicines in areas where you had higher green rates or areas, patches of green. And that can be correlated with nature therapy. When people have more than just concrete to go to and they have green, it might slow down that stress response. It might slow down the need to be always focusing. The more we stay on a screen, the more we stay in a seated position, the more obese we'll get and the more nature deprived we'll be. Richard Louv came up with a book called Last Child in the Woods, and it talked about the correlation between obesity, ADHD, and being nature deprived, or society having less and less green to get out and enjoy. There's something that we are hardwired to experience as far as being in a savanna, which is best witnessed when you go out and get into nature, whether it's a mountaintop, a savanna, a beach, or a forest preserve. You get out there and something that calms you. And that's why I think that if you want your senses to be overwhelmed, you get into this area, but you make it a routine thing. When I empower people to make changes or try to get the benefits of breath work and meditation, I usually say, do something in the morning, do something at night, do it for about 3 to 4 weeks straight, and then see how you feel. If you have something that regimented, the brain appreciates it, it's easy to reproduce, and it becomes effortless and sustainable. Well, same thing with getting out to nature. Even though it's raining today, there's still something powerful you can experience. And when you get out to nature, just walking, you actually have to watch your step and then watch nature. Watch your step and then watch nature. I like the idea that when you focus in on a step or a task, the sympathetic system is turned on. That's the fight or flight system. When you finish the task, then you defocus and look at the broader picture, the parasympathetic system is turned on and you just enjoy. So that's why I think the benefit of being out on a trail is you're focusing on your step and then you're relaxing. You're focusing on your step and then you're relaxing and observing. And that is great exercise for anyone, adult or child, to kind of go between sympathetic, parasympathetic response on a regular basis. It's so often that if you're just in front of a screen for 8 hours a day, you're just focusing and your sympathetic response dominant. If you have no parasympathetic response to balance that out, this will be the majority of your day. This will probably be your night, and that's what I think leads to insomnia. And also during the day it leads to hypertension, leads to upset stomachs, leads to anxiety, leads to mood disorder, and leads to palpitations too. All that stuff, when unbalanced with a parasympathetic practice, is not healthy. And I think that's the predicament that brings most people to the emergency room. So without finding a downside to getting out to nature, I think it's worth the investment, at least as a trial. I cannot see how you won't love and enjoy and feel good about getting out. Again, I'm a hiker, so I love getting out. I don't care what the weather is. I've done videos when there's rain, snow, ice, heat, bugs, and it always drives me there. It slows down the thought process, and I just I think humans are hardwired to be out in a place where there's peace. What I usually will suggest for people who are new to this is maybe start to search on Google Maps about where you live. Try to focus down and then zoom out. If you get a satellite view and you zoom out from where you live or where you work and you see patches of green on a satellite view, zoom in on those green patches, find out if they're golf courses. If they're golf courses, you can't go, but if they're forest preserves and they're on your way home or on your way to work, you might want to stop by. Just being in the parking lot will give you a sense of slow, give you a sense of peace. Getting out on the trail will be another additive benefit if you can do that as well. My objective is for everybody to feel the joy and peace that they felt when they were in their 20s and 30s. I think we get away from that, and we're prisoners to the idea that as you get older, you have to slow down, you have to gain weight, and you're going to be on a bunch of medicines. And I don't think that's true. I think you can break that paradigm. Now, I don't expect you to be as skinny and have as much hair as you did when you were in your 20s and 30s, but again, feeling the joy and peace is what we'll shoot for and strive for. I think when you get that nugget of a change in your heart and in your mind, those are the building blocks that every cell in your body is looking for to be bulletproof, to live to 100, be productive, enjoy life. There are studies that are out there on the benefits of nature. I don't think that we have to spend a few $1,000,000 to prove the fact that being out in nature is useful for every cell in your body, for every disease process. I think even cancer and heart disease will benefit from getting outside and slowing down or getting disconnected from those screens. Evidence-based medicine will always say you have to have proof before you do it, but the good thing is that there are no side effects. When investigating a therapy for any disease process, you always have to have the benefits and you always have to have the side effects. I think hands down, we are hardwired and built to survive and strive better when we're outdoors.